investment company in Africa. We have investment and operations across different, healthcare value chain across the continent. We have investment in logistics. We have investment in diagnostics. We have investment in retail pharmacy. We have investment in drug manufacturing. We have investment in telemedicine and digital marketing. We also have investment in hospital operations as much as possible. So very quickly, like I said, my name is Ajibola Bakari, and I will be the moderator for this webinar series. Again, I have Dr. Godwin Iyeme. Is a member of our medical team, and they've actually been they've been at the forefront of the battle against the pandemic. So let me just reel out some of our achievements and some of our activities so far. Currently, we have our sample collection booth across over 13 states in Nigeria today. The sample collection booths have actually, they've been able to make sample collection safer, easier, and faster. This actually was Flying Doctors' creation. This was actually Flying Doctors' initiative. When the news about healthcare workers' infection, first started, we thought about ways to mitigate against, healthcare workers' infection as much as possible. And that was what prompted us, and that was what prompted Flying Doctors Healthcare Investment to come up with a sample collection board, which, at the moment is in operation in over 12 states of Nigeria to help collect samples for onward transport to the molecular laboratories for RT-PCR tests. We were very involved, in conjunction with young presidents of organizations. It's a worldwide network of young CEOs and presidents of organizations, and we're very, very instructive in the collaboration just to set up the ATOSA Isolation Center. That's a public-private partnership with the Lagos State government as well. We also have a private isolation center currently operational in Rivers State. We have at the moment 3 molecular laboratories operational across the country. We have 2 in Rivers State, and we have 1 in Ogun State in collaboration in PPP with the Ogun State government as well. These are just some of the things that we've been able to do, as well as we're also very involved in transportation of medical equipment and consumables across all the isolation centers that we have in Nigeria. On a daily basis, we also transported well over 200 liters of oxygen on a daily basis across all of the isolation centers that we have in Nigeria as well. So this is a bit of a summary of our activities, of our achievement, and some of the frontline activities that we've been involved with since the beginning of the pandemic. So we're just going to give way for Dr. Godwin to have his presentation right about now. But then I just want us to know about a few, I don't want to call them rules, but then I would want to advise and say that we all keep our microphones on mute, and questions as much as possible will be taken immediately after Dr. Godwin's presentation. So in case in the course of his presentation you have questions that you want to ask, you have clarifications that you need answers to, or you have any other information that you think will be very important for you to understand, the management of long COVID generally, please, you can actually note them down and we will take them after Dr. Godwin's session. So right about now, I will just introduce Dr. Godwin. Dr. Godwin is one of our medical team currently in Port Harcourt. Is leading the team currently in Port Harcourt, one of our isolation centers in Port Harcourt, and has been able to manage well over on the average of about 1,500 patients, both on our telemedicine platform and at the isolation center. So Dr. Godwin, I'm just going to go ahead to start the presentation now so that you can have the floor. Dr. Godwin.
Good afternoon, everyone.
Good afternoon, doctor.
Yeah, can you hear me? Yeah, how are you doing? How's everybody doing? Good afternoon. Yeah, this afternoon we're talking about how to manage. Yeah, this afternoon we're talking about how to manage long COVID. Before I go further, I would like to introduce myself. I'm Dr. Godwin Eheme. Like Ajibola mentioned, we've been at the forefront in Rivers State, Nigeria, and it's been quite challenging, but also interesting. We've been able to manage about 1,500 cases via telemedicine and also the admission into the isolation center. And before I go further, I'm going to be listing out the contents of this presentation. Can I have the first slide, please? Okay. It's going to start with an overview of the coronavirus. Then I'll go further to introduce this long COVID. And when you talk about common symptoms of long COVID, also going to mention the group of persons that risks of long COVID. We're also going to talk about how to manage this condition, then also mention how to protect ourselves and others. Okay, yeah, I'll start by talking about the overview. From the graph here, you can see that as at 20th of January 2021, we have new cases about 1,386 cases, an average of 1,527. At the moment, as at January 22nd, we have a total cases of 115,000, and then worldwide, globally, we've had 96.2 million. Now, let's go straight to the introduction. I'm sure everyone will be surprised and, we are not through with COVID itself and we are going into long COVID. In quotes, we are not through with the short COVID and now we are now hearing of long COVID. First of all, coronavirus is a viral condition that affects the respiratory system and other parts of the body. I'll try to be as comprehensive as possible because I know that. Yeah, can you hear me? I'll try to be as comprehensive because I know that we also have as we have non-medicals, we also have medical personnel on this platform. So the studies have shown that COVID-19 affects much more than the respiratory system, and that's a fact because the mechanism of this virus is that it gets into the body, causes some injuries to different parts of the body, releasing some cytokines, and the effect is what we see with the patients. So there's been a growing number of people around the world who have survived COVID-19, only to find persistent symptoms lasting weeks and even months. This phenomenon is known as long COVID, and the people affected are often known as long haulers. Now, long COVID basically do not have a single or strict definition. It's interesting to know that this word long COVID came up in May 2020. It came out as a hashtag on Twitter by Elisa Perigo, is an archaeologist at the University College, UK, London. And this was how scientists came together and they wanted to know more about this condition. I want to define long COVID medically, and like I said, there's no single definition, but let's take from the British NICE. When I mean NICE, it's an acronym for National Institute for Health and Case Excellence. It defines long COVID as signs and symptoms that develop during or after an infection consistent with COVID-19, and it continues for more than 12 weeks and can't be explained by alternative diagnosis. It's very important we know that long COVID put in place having positive of COVID-19 everywhere. You don't easily. Can you hear me? Can you hear me?
The network is not very good, Doc. It's not just breaking and it's not very clear. Sorry.
Oh, okay. Is it better now? Is it better now?
I don't know about other people. We hear the start and then somehow at the end it fades out. So I don't know. Sorry about that.
Okay, but can you hear me now? Is it better now? Actually, the network here in Port Harcourt, it's quite poor because of the Harmattan.
Please go ahead, sir. I think you can hear you.
Okay, let me go ahead. Okay, now where it started as what we call the post-acute COVID. This occurs 3 weeks after COVID infection. Then this now have extended to chronic COVID, and we've seen a situation in which this occurs 12 weeks after the infection. There are common symptoms that present itself. We have coughing, ongoing fatigue, body aches, joint pains, shortness of breath, loss of taste and smell, difficulty in sleeping, headaches, and brain fog. We found out that your memory, could be affected with this condition. I hope you can hear me. Okay, so long COVID, and what I'm basically saying is that after an individual gets infected with this virus, even when he has tested negative, the symptoms can still keep presenting himself. And we've seen cases in which it comes and it goes. But let me just give you this statistics. We found out that for long COVID, in terms of its incidence in male and female, it's twice as more in the females than the male. That's for the long COVID. But for the acute phase of COVID, it's more in the males. So let's have it at the back of our mind. And in addition, there was a study that was done in Sweden, and we found out that children have presented with this condition. Now, causes of long COVID. We found out that viruses that cause COVID can trigger an overactive immune response, which causes damage throughout the body. Like I said, it could come in through the respiratory tract, through the respiratory system, but it affects different parts of the body. It could affect the neurological system, We've also had situations in which there are skin rashes. So dermatologically, COVID presents itself. Now the question is, who has risks? For long COVID, all ages are at risk. Ages, we found that children are at risk, the young and people are at risk, the elderly are at risk. Number 2 risk factor is excess weight, obesity. Obesity has been implicated in this long COVID situation. Number 3, we have cases of asthma. Number 4, we've had people that had most symptoms in that first week of COVID infection. A patient comes in with COVID, is tested positive with COVID, and we find out that basically the symptoms of cough, difficulty in breathing, weakness, and loss of smell, ability that this individual will end up with long COVID. But in the long run, after different studies, conclusion has been made that at the moment we have 10% of individuals that have come with long COVID. Just imagine 100 persons having this condition. After 3 to 12 weeks, about 10% of them have been investigated and found to have long COVID. Now, the big question is how to manage long COVID. How to manage long COVID. Healthcare. Can we go to the next slide, please? Thank you. How to manage long COVID. Healthcare personnel advise that people with long COVID should learn their patterns, learn what brings alter, exhaustion, and or the other symptoms, and try to avoid those things. Basically, like Ajibola mentioned, the cases we've seen in Nigeria, I will tell you this, most of them have been asymptomatic and very mild, although we've had some serious conditions which we are well managed in our center. First of all, as a patient that has this symptoms persisting for 3 weeks and above, he needs to know his pattern. He needs to know what makes him or her exhausted, tired, fatigue. So once you know this, one, you need to manage your energy. But before then, call through telemedicine. You call through telemedicine. You call your doctor on the phone and explain to him. If there are doubts, there are investigations that could be done. He could take a blood sample for a full blood count, liver function test, EU and SIDA, check your kidneys. Then we could also do the D dimers. We could do the C-reactive proteins. It's important because COVID has some cardiological injury. It could present as injury to the cardiovascular system, and thereby there's this risks of thromboembolism. What I mean by thromboembolism, there could be clot formations in the system, thereby leading to effective symptoms and life-threatening symptoms in such patients. So having ruled that out, the patient's a very good history will be taken, and will know how is his daily activities, how is his life pattern. It's important to look at the work-life balance. If you're able to take reduced schedule or leave or absence, you may want to consider it. You use memory aids like calendars, lists, post-it notes, which will help, and set alarms on your phone with reminders. And I will mention this in other parts of the world, there is usually an app where you can just put in your symptoms and send it to your healthcare provider, and they can, discuss with you and finally make decide whether it's is this long COVID or not. So another thing is you need to have rest, have comfort, sleep, hygiene. You ensure that you get enough rest. Reduce screen time before bed. Put filters on your phone, your computers. Get rid of the blue light, particularly in the evening. As you move around your home, keep essentials, your phone, your charger, lip band, water, snacks, in a small bag, so you can always reach it, so you don't, stress yourself. In the UK, we found out that there's what we call pacing. You do your activities, you take a break, you continue your activity. Just study yourself. Medically, we advise those that have long COVID that they should always try to, reach out to their doctors, discuss their symptoms. If it's getting better, you let your doctor go. If it's getting worse, you also communicate with your doctor. And very importantly, we found out spirometry helps. Spirometry is used, it's just like exercising the lungs, and we use chest physiotherapy, Yes, which spirometries are not readily available. We advise that the individual use balloon, just keep blowing balloon, because the process of balloon, you inhale to exhale, so you take enough volume of air into your lungs and you push it out. So it's more like exercising the lungs. Before I go further, let me just state that the commonest symptom of long COVID is extreme fatigue. Most patients complain of them being so tired, they can't just do the activities they are used to. So it's important we take note of that. In Flying Doctors here, we have telemedicine supports and home care. We have, like I said, we've been dealing with this condition for I think this should be the 8 months now in Port Harcourt, River State, and I'm sure it's been more than that in other parts of the country for Flying Doctors. We have trained doctors and nurses that can administer medical care to you via telemedicine, televisit appointments. We have applications. We have electronic medical records that you can even, while we have your medical details, we can see you on the screen via technology. We schedule spirometry appointments, and we watch you exercise. You do your take some exercise, move around. Also with your lungs, this helps to make individuals recover. Like COVID, when it comes in, it really causes some damages to some parts of the body. And research has shown that the lungs and the heart have been affected. In fact, there are situations where we have permanent damage to the lungs. Then also, the long COVID patients also have had history of post-intensive care syndrome, as in they were admitted in the ICU, and after that, they kept, even when they turned negative, they kept symptoms of long COVID. We also found out that there's what we call a post-viral fatigue. Medically, we call it myalgic encephalomyelitis. It affects the muscles. Another word for it is the chronic fatigue syndrome. So it's important we always communicate with our healthcare providers. We are readily available to offer assistance to both mild and acute cases. There's what we call a telemedicine pack. We have some medications there. If there's any patient that is positive, we have systems, logistics to send it to the patient, and we keep following up the patient from the beginning to the end of the condition. I will go into ourselves from how to protect ourselves and others. It's important we do things not to get to this point. It's always said prevention is better than cure. It will forever be better than cure. You will spend far, far lesser preventing a condition than curing it. So preventive measures, it's important that if you feel unwell, you stay at home, self-isolate, then clean your hands regularly with soap and water, 20 to 40 seconds hand wash. Also, you can use your alcohol-based hand sanitizer. Cover your nose and mouth when coughing, or you use a disposable tissue. Avoid touching your eyes and mouth. Maintain at least 1 to 2 meters distance from each other. Stay away from crowd. Use a fabric mask. They have a fabric one, they have the medical one, or surgical masks when they are individuals with higher risks, then regularly clean or disinfect surfaces. So with this, we've just had a presentation, a discussion on long COVID. We are going to, there's going to be opportunity to ask questions. We are from, I'm going to repeat again, we're from Flying Doctors. The contacts is available here. You can reach us via this contact on the screen, and we'll be very willing to help to support you from, like I said, from the beginning to the end of this situation, this pandemic we have found ourselves in. Thank you very much.
Thank you very much, Dr. Godwin, for that very insightful session. Quite unfortunate that we had a bit of network issues here and there, and it actually impaired, it prevented us from actually hearing us as much as we expected to. But very quickly, I will just do a recap, more of a summary of what Dr. Godwin talked about. Long COVID has actually been identified as a possible after effect of the COVID-19 infection. Out of about a population of 10%, it's actually been discovered that about 4 or 5 people actually suffer from long COVID. In the UK at the moment, there are about 69 or 70 facilities that are actually opened to manage long COVID symptoms alone, not the COVID-19 itself, just for the long COVID. And that goes on to explain and talk about how important and how very dangerous, if I can use that, the long COVID, pose to human health. Essentially, we talked about the management of long COVID, the things that you should do, the things that you should not do. But most importantly, and very actually very instructive, is the fact that it's been observed that for after every COVID infection, there's usually some sort of, I don't want to call it a damage, but there's usually a reorientation of the lungs, like some changes to the lungs. So much so that if you're not careful, if you don't actually take time to observe and to know these changes, you might not actually know that there are changes, to your lungs already. So that's why we actually talked about the spirometry. The spirometry actually helps to, it's actually like a physiotherapy session that helps to look at, it measures the activity or how your lung was before the infection and how your lung is, after the infection. So it helps to achieve some sort of a balance, and also helps you train, your lungs back to the way it actually should be, and to the normal state that it should be. And Dr. Godwin talked about the use of balloons to exercise and put your lungs to test, to be able to know that yes, you're actually at the normal stage that the lungs should be. Essentially, we've realized that because the COVID-19 infection is actually here. At the moment, the vaccination are actually ongoing. We don't know when COVID-19 would actually go away. So it's actually very important for us all, as individuals, as organizations, to take preventive measures against the COVID-19 infection. Like I said in the course of my introduction, at the moment, we are managing well over 1,500 patients, both mild, symptomatic, and asymptomatic patients across Nigeria. We have inventions, we have COVID-19 innovations currently in use, not only in Nigeria, but also in West Africa, to aid sample collection as much as possible. We also work with organizations, we work with government institutions, we work with individuals. A lot of organizations prior to resumption after the COVID-19 lockdown, actually, were on on our client list in terms of COVID-19 testing. So we actually do COVID-19 testing. We for confirmed cases, we monitor them via our telemedicine and home care support. We also help to facilitate admission into isolation centers across the country. And also, as much as possible, we're an aeromedical transfer company. So as much as possible, we've also, since the beginning of the COVID-19 pandemic, we've received nothing less than 250 requests for transfers, for COVID-19 transfer. Did I say 250? We've received more than 350 requests, not only in Nigeria, but across Africa. So we've had to transfer people, we've had to transfer patients. We have a specialized isolation pod, which is called the IsoPod. Is a vacuum space, in which we transfer COVID-19 patients and other infectious diseases. It helps to give some sort of safety to the healthcare workers, to our medical personnel, as well as aviation crew. So it cordons, and it's a chamber in which the patient goes in and is cordoned off and kept at bay from the medical team, as well as the aviation crew on board the aircraft. So as much as possible, we have our contact address, just in case you want to contact us, or you want to talk to us, you want to ask questions, or there are few clarifications that you need answers to. You can actually copy our contact address on the screen right now, and we're willing and we are comfortable talking to you, and we're happy taking your request anytime and any day. So right now, just in case you have any questions that you want to ask Dr. Godwin, we can now take questions. And if you have any question, you can either type it on the chat room, or you unmute your mic and you ask your questions directly. So I will be taking those questions, directing them to Dr. Godwin, and he will be providing answers as much as possible. All right, do we have questions, please?
Hello, good afternoon.
Good afternoon, sir.
Yes, thank you very much for your presentation on long COVID. I'm Dr. Andrew Yaji. I work in Makodi, Benue State Teaching Hospital, University Teaching Hospital. My concern is, it's a good thing that you are bringing this topic up. But my concern, as you may know, in the country, in Nigeria, is the expectation that people should resume from work as soon as there's recovery. People may not understand.
Hello, Dr. Andrew, are you there?
Something like long COVID. So I would like to know, how do you think we can overcome that, or we can go around that? And then secondly, hello?
Hello, Dr. Andrew.
Hello?
We lost you at some point. Can you take your first question again? We lost you at some point.
Okay. I said my concern, as we know in the country, is that organizations and employers would expect their employees to return to work as soon as they are certified to be well, or as soon as they are certified to have recovered. They do not understand anything like long COVID and the symptoms that coming with it, for prolonged symptoms after somebody has recovered, has been certified to have recovered from COVID. So I say, how can we go around that? I say it's a good thing that you are bringing up this topic.
All right, sir. Thank you very much. Your second question, sir.
Hello? Okay. Hello, did you get my question now, please?
Yes, I did, sir.
Okay. The other one is, I also like to imagine that depending on the degree or on the degree of symptoms person had during COVID. I want to know, are the symptoms all the same? It to be the same for somebody who just tested positive and was asymptomatic, somebody who just had some breathlessness, somebody who had fever, and who had some oxygen saturation very low, the different degrees of the presentation of COVID. Would you expect that they will have, the same symptoms of long COVID? I don't know if you get that question. Would you expect somebody with mild COVID symptoms to now develop, say, major long COVID symptoms? Is there any correlation between the degree of COVID illness and the symptoms person can present with, for long COVID? Thank you.
All right, thank you very much, Dr. Andrew. Dr. Godwin, did you get the questions?
Okay, I didn't get the first question, but the second question was clear.
All right, the first question is about employers that actually expect employees to resume at work immediately after they test negative, after being positive before. So how do we manage this as much as possible to ensure that employers give, their employees some chance to actually, some room for the possibility of long COVID before coming back to work? How do we manage this in the corporate world?
Okay, I'll start by saying this. It depends on the organization. If the company is follow the occupational health policies, they'll have to interact with the company's medical personnel, because when the individual has the symptoms, he will definitely report to his doctor, his company doctor, that will refer, that will give a feedback to the HR. So I think there can be that synergy. The management of the company will also be in touch with the health or the medical department of the company, and they can always have a compromise and give that patient or that individual a rest or a little leave to get back in his health status.
All right, can you go on to take the second question, Doctor?
Okay, he talked about, just correct me, please. He talked about an individual having mild symptoms initially, then after a while, the symptoms gets worse and presents itself as long COVID. Am I correct?
No, he's saying that, is it possible that someone that had mild COVID-19 symptoms, can the person come up with long COVID-19 symptoms, like chronic COVID-19 symptoms? For instance, you just have mild, almost asymptomatic. Is it possible that you were initially asymptomatic, can you come up with long COVID symptoms? Is it possible?
Okay, this is a novel, different studies, different feedbacks from different parts of the world and patients. From what we've seen, like I mentioned, it's individuals that have had several symptoms. They later come up with some symptoms that still persisting. We've not seen situations in which an individual is asymptomatic. The definition, like I said, it's when the symptoms still remain. It presents with a particular symptoms, and after a duration, a longer duration, that symptoms remain. So we had this patients in which are asymptomatic and they come back with it.
Okay, so in essence, Dr. Godwin is trying to say that majority of the people that come up with long COVID symptoms are people that initially had COVID-19 symptoms, that had chronic COVID-19 symptoms, people with asymptomatic symptoms, people that were asymptomatic or people that had mild symptoms hardly come up with long COVID symptoms. Is that what you're saying, doctor?
Yes, yes.
All right. Thank you very much, doctor. All right, thank you very much, doctor. In addition to the first question about employers allowing the employee take a few time to actually get better and recover fully before coming back to work, one of the reasons why we thought about putting this together is also to inform people and also make people aware of the possibility of long COVID, the possibility of people developing and still having symptoms even after testing negative. And we know that it might almost be impossible to reach everybody, to reach all organizations, but we thought if we start this series to talk about long COVID and educate people, we actually might be able eventually to let people know and to also sensitize the general public about long COVID. So just in case, even not even on, on the corporate level, even on an individual basis, so that you don't start to get scared when after being negative, after testing negative, you still have a few symptoms. It's actually normal, according to research, to also have symptoms after being negative, after an initial infection, after being positive for COVID-19. And also, we also, through our telemedicine platform, we can also monitor you from the point of infection to the point of you being negative, even onward onto long COVID, just in case you come up with symptoms of long COVID. We can manage employees of organizations. We can also manage individuals through either the telemedicine or the home care, depending on which of these services that you're actually comfortable with. Do we have any other question, please? Any other question from anybody in the audience, from the participants? Anything you want to know about Flying Doctors Nigeria, about Flying Doctors Healthcare Investment Company, about our COVID-19 activities, about some of our interventions and some of our activities around COVID-19, or anything on long COVID, or just in case you want to ask any questions about, you want to ask any question on the management of COVID-19 generally. Any questions from anybody, please?
Hello? Hello?
Hello, good afternoon, sir.
Yes, please, Dr. I've been following Flying Doctors for quite a while. Very impressive what you are doing, and I really need to give a commendation for what you are doing, the investment company and the rest of it. I want to know, I thought this was limited to the long COVID presentation. So if you are inviting questions for FDIC, Flying Doctors generally, then I would like to know, is there any room, any opportunity for like some of the investments you are doing? I know you are inviting one in an investment now to go Africa-wide or so. How do people come in? Like, how can people like me participate, or organizations participate in funding, portfolio funding, and so on? Thank you. Portfolio investment and all that. Thank you.
All right, thank you very much, Dr. Andrew. At the moment, by the time we get to the stage where we begin to invest in organizations, portfolio companies, and other investees, definitely we're going to come. We're going to come public about it. But at the moment, we're still trying to talk with our investors. We're still trying to, as much as possible, still do a bit of internal work as regards, healthcare investment in Africa. We have, quite a number of investors at the moment. that we're speaking with, a lot of investment that we already have. But at the moment, by the time we get to the stage where we start to invest in organizations, in companies, especially organizations in the healthcare and wellness chain, will come public about it, and the general public will be able to benefit from it.
Wait, sorry, do you mean an IPO? You mean an IPO or just or private placement? Or
I didn't hear you, doctor.
I said, do you mean an IPO, initial public offer, or private placement, or private offers, or like what categories of public do you mean that you come out to the public?
Okay, doctor. Doctor, for the purpose of this question, I would give you an email that you can send your questions to, and we would give you answers, accordingly as regards that. That's actually a question on an investment side of the organization. So I will just type out the email on the chat room. So in case you have any more questions on the investment side, you can actually send in your questions there, and we'll be able to take it as much as possible, because the essence is just so that, as much questions as people have regarding the investment arm of the Flying Doctors Healthcare Investment Company, we can take all of them together, in one breath. Did you hear me, sir?
I think he has responded. Sent a chat.
Any more questions, please, from anybody on management of long COVID or the management of coronavirus infection generally?
Yeah, sorry, I'd like to ask a question. That's okay?
That's okay, sir.
My name is James Adenuga. So my question is regarding management of COVID as vis-a-vis. So we're talking about employees. So some of my employees, maybe people get positive, haven't been tested, and they have families. Okay. So what we're finding out nowadays is that the probably long COVID development is actually getting more and more prevalent amongst household, as against just the workforce. So, and this is my question. So if you have a household of, say, 6 people, like we have 1 or 2 cases, where a member of the household is tested positive, so I would say they are in the bubble, and the other people tested negative, but they all live together. Okay. So the singular person that tested positive for hypothetically, the woman tested positive. She's not the staff; it's the husband that's the staff in this case. But they all did test at the same time. So after about 14 days, where they doing a retest, would it be everybody being retested, or just the person who was initially positive and have recovered in terms of clinically? What's your view on this?
Dr. Godwin, did you get the question?
Yes, the last part.
Okay, yeah, Dr. So what we're trying to say is that, so for retest, in case where a member of a household, somebody is positive and every other person was negative, at the time where the retest is due, following recovery from clinical indications, would everybody go for retest, or just the person who was positive in the first instance?
Okay, thank you very much for that question. First of all, once an individual gets a positive result, we are interested not just for the individual, but also members of his family. So we'll advise the individuals to be on isolation, which we have protocols concerning isolation. And we'll also encourage the individual to follow such protocols. Yes, there are situations in which there could be breach in that protocol. At the same time, in as much as that individual is there, we also, as a telemedicine, we also want to get feedbacks from the family members, and also make sure that there are no symptoms arising among the family members. Now, if that individual, as in the positive patient, later turns towards the 14th day and is free, and any member of the family comes up with any symptom, then they will have to be tested.
Okay, so to be, I mean, because I thought the NCDC sent a new case definition guideline, I think earlier in the week also, which I think addressed a few other things. So I get you. So it should be based on symptoms rather than just because they are in the same bubble. Because the reason why I'm asking is that they've done, there was a contact tracing for other people as well. Not necessarily the people, but in the case of these people in the same bubble, I was just wondering, I was trying to analyze it, what will have been the best approach.
Okay, if you're talking generally, if we're going to take it from a general point of view, it's based on the availability of diagnostic centers. But once the resources, once the diagnostic centers are readily available, then all members of the family can be retested.
All right, excellent. Thank you very much. That's what I thought actually, but thanks.
In addition to that, sir, it will be advisable to have all the members of the family tested for the virus, but essentially we might just allow the 14 days quarantine period for them to also come up with symptoms. In case they come up with symptoms, yes, it will be advisable that they go for test. But in case after 14 days, there are no symptoms and they are all very fine, we might not, or there might not be a need for testing. But essentially, just to be on the very safe side, once a member of the family tests positive for the virus, it is just advisable that every member of the family also undergoes the RT-PCR test, just so that the management can start as soon as possible, and we can also, get it done with as soon as possible. So it's advisable if the resources is available for the test. Otherwise, we might just want to wait for the recommended 14 days quarantine period before we begin to see manifestations of symptoms.
Thank you.
Do we have any other questions from any other person? We have your database, your email address, so we'll be sharing these slides with you. You can also go through the slides at your free time just to also intimate yourself more about long COVID and the workings of long COVID and how you can also manage, the long COVID infections and the symptoms within the confines of your home or your office as much as possible. I just want to stress a little bit more on how Flying Doctors Healthcare Investment Company, how we've been able to manage, a lot of mild and asymptomatic cases via our telemedicine platform. Now, usually we have our own pack, our telemedicine pack, that contains drugs such as azithromycin, drugs such as zinc, such as vitamin C. And we also have a few medical consumables, just such as pulse oximeter. Pulse oximeter measures your SpO2 level. We also have the digital thermometer that also, monitors your temperature on a daily basis. So the schedule is depending on how convenient it is for you. Sometimes we do twice in a day. Our medical personnel call all our patients to, monitor them, to take their vitals, and to probably ask for, the manifestation of symptoms. So it depends on how the one that is actually convenient for you. We can take on a 2 times in a day basis. We can do a 1 time in a day basis, depending on your own schedule. So that's how we actually monitor our patients via our telemedicine platform. And we have our electronic medical records. That's actually where we record all the vitals and all of the observations that we get from you over time, and we're able to make informed judgment about your COVID-19 situation and status, and also recommend when you go for a retest. Do we have any other questions, please?
Hello?
Hello?
Can you hear me?
Yes, I can hear you, sir.
Oh, good afternoon. My question is more or less
sir.
like an observation and a comment. So I want to first thank you for this platform. It speaks a lot of what your company is doing and the whole team. So I just want to, I've observed that most people like I interact with, some don't observe the precautions, the COVID precautions. Okay, some don't observe the COVID precautions again, and it's obvious that since it's something that we want to um, try to curtail, and it's something that everybody is trying to prevent. So if one person is trying to observe all the precautions and the rest, and the others are not trying to do that, so it boils down to a futile effort, because at the end you are protecting yourself while the other person is not protecting himself. And we know this COVID, it has different variations that one. So my question is, I know your company is doing a lot in terms of education and the rest and everything, and partner with sister organizations. So I just want to know what the company's more effort the company is doing, the organization is doing, just to educate the public more on this, and that they shouldn't lose their guard, because basically I think people have they've lost their guard. That's why the spread is has exceeded more than we could imagine. So my observation and comments is just what the organization is doing to educate the public more again. Thank you.
Thank you very much, Mr. Adedamola. So essentially, Flying Doctors is, we are keen into the government protocols and policies as regards the prevention and the cure and the treatment of COVID-19 infection. As much as possible as an organization, we've started a campaign to intimate people and let people know about the dangers and the new wave of the virus, which we also have in Nigeria at the moment. We are keying ourselves into the policies and the programs of the Federal Ministry of Health, into the programs of the NCDC, essentially into the programs of the federal government, everything that the federal government is doing just to sensitize people and educate people about the new wave of the virus. It's actually very unfortunate that at the moment, a lot of people are actually not taking precautions against the COVID-19 virus. While that is going on, we also have a lot more people that are coming up with symptoms, a lot of more people that are actually infected with the virus. Right now, across all private isolation centers in Lagos, there are no bed spaces for admissions. That goes to tell you that a lot more people are actually infected with the COVID-19 virus. So we are keying ourselves into the programs of the Federal Ministry of Health, into the programs of the NCDC to educate people. We've actually started this webinar series. This is about the 4th of our webinar series. Before now, we've been talking about the prevention of the COVID-19 virus, how people can actually protect themselves, protect their families, protect their workers, protect their friends from the virus, especially themselves. But over time, we also realized that from the cases that we manage and from our clients, we have a lot of people that have complained about the presence of a few symptoms, even after they've tested positive. And that instructed the need, or that brought about the need for this series on long COVID. So we thought to educate the people and the public about the possibilities, so that just in case you've actually been infected, you've been positive before, and now you test negative, and you can actually feel, the presence of some of the symptoms that you've had before, shortness of breath, cough, and a few other symptoms that we have. You can actually be rest assured. It's not like you should turn blind eyes to them. You can actually talk to us, but then it's not anything to be worried about, or to start to panic about, or whether you're actually positive or whether you're negative. It is possible, there's a possibility that even after you're positive, or sorry, even after you're negative, you can still over time have some of these symptoms. So yes, we will not stop educating the public. Across all our sample collection centers in Nigeria, we have our healthcare workers that sensitize people. So even after collecting your samples, we also try to educate you on why you should protect yourself, wear your mask often, talk to, wash your hands, observe the usual, hygiene, the usual conventional hygiene that, we always do. Wash your hands regularly, keep yourself, safe and free. And if you don't have to go out, if there's no need for you to go out, if you can work from the confines of your home, if you can do all you can from the confines of your home, please do as much as possible. And if you must, please wear your mask and stay protected. Observe the social distance as much as possible, and keep yourself safe and your family safe. Sorry, do you have any other questions for Dr. Godwin or for flying doctors that you want us to take? All right, so I guess in the absence of no other question, we will just go ahead to end the discussion today. Like I said earlier, we would share the slides with you via your email. You can actually go through the slides when you're free to, as much as possible. You can also read through again, just so that you're clear and you understand what long COVID is and how to manage long COVID. Again, just to be able to, put it in perspective and, let us understand how long COVID is and its presence actually, or the possibility of long COVID. I said it earlier that in the United Kingdom at the moment, the NHS actually, they have over 69 facilities just for the management of long COVID alone. That's just to help us put it in perspective and help us understand how much of a situation that the long COVID is. All right, in the absence of any other question, thank you very much, ladies and gentlemen, for joining us today on our webinar series. We appreciate your time, we appreciate your questions, and we appreciate you for actually listening to Dr. Godwin and our medical team, talk about long COVID and how to manage and prevent yourself and your families as much as possible. Thank you very much, and until we come your way again, just in case you have our contact details already on your screen at the moment, in case you have any question after now, please feel free to talk to us. You can call any of the lines. We have 24/7 emergency lines that are operational. You can also send emails to us, on the emails on the screen as well. And we look forward to responding and also taking your questions as much as possible. Thank you very much, ladies and gentlemen, and enjoy the rest of your day.